So what is in the name? As a psychosexual therapist, when you're sitting in the room with your clients, you feel often that your role changes from being an educator to a coach, to a therapist, to a counselor, to a confidant, and also, believe it or not, sometimes as an investigator, because you need to see what happened that night that instigated that sort of a problem. And so the roles change all the time. On that note, I thought H.A.T, Holistic Assessment and Therapies, the name of the training, would embody that, as well as giving you the picture as we are going to combine the psycho, socio, bio, pharmacological, all sorts of interplays that come to interact with one another to shape a sexual problem or help us solve it. Now people ask me, why is it even important to be mindful of the different roles that we play in the room? We are all trained and nothing can go wrong. I really realized that the way that you can be most helpful is to offer them a holistic approach, in a sense that you combine all these roles, but also you're aware of the roles. For example, when I'm working with them and I put on my coaching hat, I will come up with resources for them. Or if I'm coming up with an investigator's hat, for example, I will ask them different questions. So the formulating of the questions, further questions to get to the depth of the issue would be different. The tools that I would come up with would be different. The management and treatment solutions that I would offer would be different, depending on the hat that I'm wearing. So on that note, I really truly think that it's important for you to know and be mindful of who you are in front of the clients. The other aspect is from the client's perspective towards you, as how they see you, how they view you, what they expect from you as a therapist, as a counselor, as a coach, in whatever capacity that you're helping your clients. So on that note, I feel it's pretty important to be mindful of who you are and what the dynamic is in that moment inside the session with your client. This training is run in 3 levels. One is the foundation level, the second one is the intermediate, and the last one would be the advanced. I'm going just to support you with the supervision sessions after that, and also we have a very nice H.A.T community, and that's why I would like to personally interview everybody who is interested in the course, just to make sure that I put the people together whose dynamic really match well together and they can complement one another's background, based on academic background as well as personality. So far we've been very successful in bringing good groups together that function really well and support each other very well. Any mental health practitioner who is licensed, or maybe if you're a student at the last year of your internship who are interested in assessment and treating sexual dysfunctions, you're most than welcome to join us. And also, if you would like me to tailor something for your group, you're a medical practice group more interested in sexual medicine or psychopharmacology part of it, or you're more interested in the medical communication with your patients in a medical setting, or if you're interested in very specific areas like, for example, pain disorders or erectile dysfunction or premature ejaculation, anything that fits the need of you and your group of colleagues around you, we could always tailor-made those trainings around those models as well. And also this course is approved by the American Association for Sexuality Educators, Counselors and Therapists. So you will get CE training points for that. And we will run the course every January and September online. 80% of it will be run by myself, and 20% will be by colleagues who are experts in sexual medicine and psychopharmacology aspects of things, and also physical therapies, other areas that I don't claim to be an expert in. And all of those colleagues are world-renowned, and many of you who have worked with me, know that the caliber of colleagues that I work with. So you can guarantee a good and systematic education. It's didactic, and we have case presentation, we have self-reflection time, group reflection time, and we are going to have group presentations and lots of time for self-awareness, moving inside and outside yourself, and just to have checking point with yourself, to bring up your own biases and prejudices, previous knowledge, and whatever that you do, you can bring to the room and make the best of it. Please feel free to contact me, and I will be more than happy to speak with you, to answer your questions. To register, you can just simply go to this page and then click and pay your deposit. So I look forward to welcoming you into our H.A.T community.